Live and direct from the control tower. It's your power, music and talk radio station. Paradise 105.5 FM Calabar. Number 1 in the south of Nigeria.
Right now, you just hit that particular comment there, I got meaning well done for the work that you're doing well. That, of course, is the voice of a very, very special guest that we have right now with us in the studio. He is no other person than the very vibrant, very lively, always forward-thinking, and a man who shares the same heart with the governor for the people. He's a man who is health-oriented, and, of course, as a doctor, he cares. This is no other person than Dr. Egbe Ayuk, Commissioner, Honorable Commissioner.
Thank you so much to be here. This is really a moment of sweetness.
Absolutely.
The season of sweetness, the year of sweetness, the tenure for sweetness.
Yes.
Indeed. Indeed. Well, we'd like to welcome you especially. And it's been 2 years down the line in this season of sweetness. I'd like you to walk us through 2 years of your time as an Honorable Commissioner for Health, Cross River State.
Well, thank you so much. Let me attribute whatever is going on in the health sector to God and to His Excellency, our dear Governor. So what I'm going to talk about in a few minutes is actually his programs that he has introduced in the health sector. I will just mention a few of them. One is the revitalization of critical infrastructure in the health sector. 2, we have the health palliative program of His Excellency. 3, we have the restructured insurance policy in the state. And then 4, the invigoration of human resources management. Now, let me start with 1. When I say critical infrastructure, I'm saying that there's things you cannot do at any given time. So I'm talking about health facilities as a critical infrastructure in the health sector. I'm also talking about innovations within this this critical infrastructure. So the first thing, if you look at the program that is going on about strengthening the health sector, first thing is the revitalization of primary health care facilities. And as I speak to you, there is no local government that has not been touched by that program. In fact, I've told the governor that, said, if there is anywhere at all, let's be a little bit outside the office, and we say, okay, which sector is capable of guaranteeing, I'm flying his colors at any given time.
Absolutely.
Because I know that the ministry I lead, the health sector I lead, can guarantee the coming back of His Excellency. So, 96 healthcare facilities, if you go, then none of us here, at least each one of us comes from a local government. If you go, you see, it might not be in your village, but there are about 4 to 6, 7 healthcare facilities that are being uplifted. And they are being uplifted to be like mini hospitals. You have staff quarter, you have all those things. If you go to a tomb, for instance, there are about 6.
Wow.
There are about 6. There are some local government with 8. There are some with 6. Boki local government has 6. And so forth. So you can see that kind of arrangement going on.
So and are these with the necessary resources in there? Because,
No, we are revitalizing. When you say revitalizing, we are not only talking about physical infrastructure.
Yeah.
You are also trying to put in place the support mechanisms. For instance, if you go to each ward, our 196 wards in this state, you are going to have at least 1 midwife currently engaged.
Okay.
Because you might not have doctors, but you have a midwife that can guarantee safe delivery. So that's what I'm trying to say. These things, these health facilities you see being renovated, they're not just being renovated in terms of physical building. We are putting in critical ancillary measures also. So now, if you move from primary healthcare centers, you come to hospitals, you're going to see that His Excellency is currently building a general hospital at Ikom, in the central. So he's pursuing an equity program where at least local government areas that don't have a public hospital can boast of a hospital. So the whole Ikom axis, consisting of Etum, Ikom, and Boki, don't even have one public hospital. So that hospital at Ikom that is being constructed is a signature program of His Excellency in the Central District. But that is not all. He has recently given approval for the completion of the abandoned General Hospital at Akpabio. So Akpabio General Hospital is not St. Joseph I'm talking about. I'm talking about General Hospital that was abandoned.
Yes.
So that is taking place, and he has given also approval, and the state school is working on that. The state executive council is working on that. We have been directed to, as a matter of urgency, address the renovation of General Hospital Ukem in Podupani, General Hospital, that is the Cottage Hospital at Oban. That one is abandoned. You go there is nothing happening. Then we have also been told to update immediately IDH, that is Lawrence Essential. So these are critical infrastructure in the health sector. But then, like I said, there are innovations also, additions. If you go to General Hospital, Calabar, apart from being a setting, the way you see it, you're going to see some things added there, some innovations that have been added to General Hospital that were not there before. We have the fistula unit. It's there. It came along with His Excellency. We have the oxygen center there in that hospital. Then if you go to the lab right now, they are expanding and recalibrating the services there. So that as of today, you can conveniently do blood chemistry. You can determine your liver function test. You can determine your kidney function test in General Hospital Calabar. Those are the kind of things we are talking about. And so that is for the first program, revitalization. Now, if you look at the health palliative program, 2 prongs. The first prong is the outreach program that is majorly being carried by Her Excellency. Then
I think one is currently on the air at the moment.
Currently ongoing. And she has carried that program across the state. First, it started with the south. We went to the central, and from the central, we went to the north. In fact, the state again in the north went back to the north. Excuse me. From the north, it's now back to Calabar, and from Calabar, it will go to Ugeb. So this and across board, you see thousands and thousands of people benefiting free surgeries, particularly. As I speak to you, if you go to the General Hospital, Calabar, you cannot enter the place today because the crowd is so massive. It's so massive. So you can't even have access. Her Excellency has been able to bring international consultants from US to float the entire area. This is what we're talking about, people first agenda. Now, what has been added significantly in these 2 years is the strengthening of the health insurance policy of His Excellency. Before now, we're only talking about the formal sector, civil servants paying their small stipends and then benefiting, those who are able to benefit for now. But His Excellency has come, and we're having the informal sector coming in, people who are not workers, who are not civil servants. And that has been made possible by good-spirited people. People have adopted the policy to buy insurance for their constituents. Her Excellency has just launched her own. 500 people have been covered by her, not by government resources, her own resources, to address 500 elderly people above 65 years for 2 years. Yesterday, she flagged that up. 2 days ago, she flagged that off. I'm also buying my own, in my own small measure, in the two local government for 200.
Interesting.
Yes, you see, so, and I know of other politicians who are coming in also. Odenewa, for instance, my colleague in the Central Senatorial District, is investing a lot of millions for this very policy. So we are moving ahead. These are the key areas we are approaching, and of course, in terms of human resources, what is paramount is that the governor has been able to inject into the health sector about 240 healthcare professionals right now currently. They are receiving their appointment letters, and I am sure that by July we should be able to have a full component being deployed. But very interestingly is the fact that doctors have a reason to stay and work in Cross River. The governor has approved 100% CONMES salary structure for them. So there is
what does that mean?
Yes, CONMES is comprehensive consolidated salary structure for medical doctors. Okay. Now, that salary is what the national, every state must key into. So His Excellency came to the state and discovered that we're not paying doctors even up to 40% of that expectation. And there were attempts by the health sector workers to go on strike. The governor has come, listened to them, and has given instruction to me particularly that 100% CONMES be paid to doctors. So, and that was the reason you can't find doctors in most of our services, because of the fact that the allowances were not comparable. If you compare, look at the disparity between doctors in teaching hospitals and here, it was so huge. But now the governor has equalized that. That's what I'm trying to say. Okay. So there is no reason for you to run from the state. Yes. So, ladies and gentlemen, I think this, so far, there is no way in which I can bring everything down. But if you have further questions, you may be able to ask. But these are the key areas we have touched.
I think, Honorable Commissioner, you've touched on something that is quite important, because today, making one of the headline news, former President Obasanjo was talking about incentivizing doctors so they can stay instead of running away. So I think His Excellency is doing the right direction. Now, about those who are, employed as doctors and healthcare providers who are employed into the service of Cross River State Healthcare Services, how prepared are they, from your assessment, to give back to the society? How well prepared are they to handle, healthcare in Cross River State?
How prepared, you mean?
The doctors and healthcare givers that you have employed into the service.
You cannot be too sure of everybody, but I'm sure with what the governor is doing, with the incentives he's providing, with the service improvements he's also providing, there is no reason why any doctor employed will not want to stay and exercise his duties. So, except I don't get what you say, but I think they are prepared. If you are not prepared, you can't come and seek for
employment.
Yes, for a job. Okay. So they are prepared in the first time. But what is important, like what you have just talked about, Obasanjo, to put in place a reward system, something that will make them have a sense of belonging. Yeah. They can work 24 hours every day if there is some improvement in their welfare packages. And that is what His Excellency has done. And he has not and it has not ended there. We are currently considering the program of the critical staffing in hospitals, where you have where you have doctors, nurses, laboratory scientists, and then what is the other one? Pharmacists. The governor is putting in place an arrangement where we can extend their retirement ages from 60 to 65.
Wow. That's very applicable.
Wow.
Very, very applicable. Very, very. Okay, interesting one right there. There's so much going on in the state from what you've said. But I'm quite curious to know, where do we stand in some of the battles that we had to face during this 2-year period? Things like Lassa fever, all those viral issues and all that. That come up every now and then. Where do we stand when we face a particular challenge as a state?
I score. I'm not supposed to score myself. I would allow the observers, to do that. But I think, sincerely speaking, His Excellency has done so well in the management of outbreaks. Before we came on board, there were stories of outbreaks and people dying in hundreds. People dying. Lassa fever, all those intimidating outbreaks all over the place. But today, you can only hear of an outbreak, one case, for instance, and the next minute it disappears because we have a strong surveillance team that is addressing those. We can't completely eliminate Lassa because first, rats are there in our houses. I used to quarrel with my younger ones. I said, when you eat, wash your plate and keep, because that's the first thing to drive away rats. If you keep clean place, clean pots after you have eaten, no rat will come in there. And so they will pack away quietly. So we have done our best. Because of the environment our people live in, you can't say you won't have outbreaks. But the most important thing for us is the stage of preparedness. We are, as soon as we have a case reported, notified, there is a mechanism to mitigate it immediately. And that is what we are doing.
Let's look at this matter which came up recently, where the Cross River government, team reaffirmed commitment to family planning, the call for unity in advancing reproductive health. What is happening in that sector? Because family planning is one thing which Nigerians are somehow being to accommodate it, but at the same time they have their concerns. So in terms of this reacts to my body, that reacts to my body, here and there. But what is this reaffirmation to family planning? What are we to expect from you and from the government?
Use this medium to let you know that by next week we shall we will have activated the dialysis unit in General Hospital Calabar, so that those people with chronic kidney diseases can at least have some solutions.
Absolutely.
Within our state, rather than going to you.
Okay. Yeah. Congratulations.
Thank you.
Big win.
All right, coming up next, we have another conversation which is still bordering on health. Stay with us. It's still Paradise Unlocked.